Today we're going to start a journey to explore these important medications, each with its unique role in managing diabetes. Understanding these options is vital in appreciating how they work to control blood sugar levels, mitigate symptoms, and prevent complications. As we go into details, you'll learn about everything from insulin to semaglutide, so get ready. Stay with us to discover the top 5 types of medications used in diabetes. Now, before we jump in, remember this information is for general knowledge and informational purposes only. This video does not constitute medical advice. Always consult with a healthcare professional for diagnosis and treatment of any medical conditions. You know, I'm all about empowering you guys with knowledge to take control of your health, and understanding your medications is a huge part of that. Whether you're newly diagnosed, have been managing diabetes for a while, or just want to learn more, this video is for you. We'll break down each medication in a way that's easy to understand, so stick around. First up, we have metformin, the OG, the classic. Often the first-line treatment for type 2 diabetes. You've probably heard of it, your doctor may have even prescribed it, but how does it actually work? Metformin is like that friend who tells it like it is. It doesn't mess around when it comes to tackling high blood sugar. It works in a two-pronged approach. First, it improves your body's sensitivity to insulin, that hormone responsible for ushering glucose into your cells for energy. When your cells are resistant to insulin, sugar builds up in your bloodstream, and that's when the trouble starts. Second, metformin heads straight to the source, the liver, and tells it to cool it on the sugar production. Our liver loves to churn out glucose, especially when we're not actively eating. Metformin steps in and says, "Hold up, liver, we need to keep those sugar levels in check." Now, metformin is generally safe and effective, but like any medication, it can have side effects. The most common ones are gastrointestinal issues like nausea, diarrhea, and upset stomach. The good news is these side effects often subside over time and can be minimized by starting with a low dose and gradually increasing it. Next, we're talking about SGLT2 inhibitors, a mouthful, right? But don't worry, their mechanism of action is pretty straightforward. These medications, with names like empagliflozin, dapagliflozin, and canagliflozin, work directly on your kidneys. Think of your kidneys as your body's filtration system, constantly cleaning your blood and getting rid of waste products through urine. Now, your kidneys are smart. They usually reabsorb glucose back into the bloodstream because, well, sugar is precious energy. But in diabetes, that excess glucose needs to go. That's where SGLT2 inhibitors come in. They block the reabsorption of glucose in the kidneys, essentially telling your body, "Hey, let's flush out some of that extra sugar." This leads to lower blood sugar levels and can even have a modest effect on weight loss. One important thing to note with SGLT2 inhibitors is they can increase the risk of urinary tract infections. That's because the extra sugar in the urine can create a happy environment for bacteria to grow. So, stay hydrated, my friends, and let your doctor know if you experience any burning or pain during urination. Now let's talk about GLP-1 receptor agonists. These medications, like Ozempic, Victoza, and Trulicity, work by mimicking a naturally occurring hormone in your body called GLP-1, or glucagon-like peptide 1. GLP-1 is like the maestro of your digestive system, playing a crucial role in regulating blood sugar levels. It stimulates insulin release when you eat, slows down gastric emptying, and even signals to your brain that you're full, reducing appetite. Pretty cool, right? But in people with type 2 diabetes, the GLP-1 signal can be weak or ineffective. That's where GLP-1 receptor agonists step in. They bind to the GLP-1 receptors, amplifying the signal and enhancing its effects. This leads to improved blood sugar control, weight loss, and even some cardiovascular benefits. GLP-1 receptor agonists are usually given as injections, either daily or weekly depending on the medication. Like any medication, they can have side effects, the most common being nausea and vomiting, which usually subside over time. Moving on to DPP-4 inhibitors, another class of medications that work by increasing the power of incretin hormones, like our friend GLP-1, which we just talked about. These medications, including Januvia and Onglyza, work in a more indirect way. Remember how GLP-1 is like the maestro of your digestive system, regulating blood sugar? Well, DPP-4 is an enzyme that breaks down GLP-1, kind of like a party pooper. DPP-4 inhibitors put a stop to that party pooping action. By inhibiting DPP-4, these medications allow GLP-1 to stick around longer, doing its job of stimulating insulin release, slowing down gastric emptying, and reducing appetite. This leads to better blood sugar control and can even contribute to some weight loss. DPP-4 inhibitors are taken orally, usually once a day. They're generally well tolerated, with a low risk of side effects. However, some people may experience mild gastrointestinal issues or headaches. Last but certainly not least, we have insulin. Now, insulin is not just a medication, it's a hormone that's essential for life. It's like the key that unlocks the door for glucose to enter our cells and provide energy. In type 1 diabetes, the body's immune system mistakenly attacks and destroys the insulin-producing cells in the pancreas. This means people with type 1 diabetes need to take insulin every day to survive. Insulin is also used in some people with type 2 diabetes, especially when other medications aren't enough to manage blood sugar levels. Over time, people with type 2 diabetes may lose the ability to produce enough insulin, or their cells may become increasingly resistant to it. There are different types of insulin, each with its own onset of action and duration. Some insulins are rapid-acting, while others are long-acting, and some are a combination of both. Your doctor will work with you to determine the best type of insulin and dosage for your individual needs. Now that you are up to date on diabetic medications, take a look at our next video. Achieve perfect blood sugar levels with these 5 morning drinks. Here is the link popping up at the top of the screen. If you found this video helpful, please give it a thumbs up. Remember, always consult with a healthcare professional for any medical advice. Managing diabetes can feel overwhelming at times, but understanding your medications is a huge step towards taking control of your health. Remember, knowledge is power,